to tuberculosis. It's also important to know that most cases of primary TB resolve, heal by fibrosis and calcification, and become latent. To remember primary TB's association with children, that usually resolves by fibrosis, we'll draw a kid down here on the left side, sleeping in a burlap sack. The sleeping kid should remind you that it often resolves and becomes latent, or it hibernates for a while. Also, the sack made of burlap, which is a really fibrous material, is to remind you of the fibrosis that occurs. Also, notice he's sleeping against a shovel, and the shovel is going into the ground the same way a needle goes into the skin when you're given a TB skin test. This is a link to remind you that if someone gets a primary infection, they then develop a positive tuberculin skin test, or a positive PPD. This manifests as a wheal on the skin where the TB particles are injected. The lump is due to the type 4 hypersensitivity reaction, and this wheal is represented by this lump of dirt that the shovel's created. You should also take note that the tuberculin skin test can be positive in an active infection, a latent infection, or if the patient has ever received a vaccine known as the BCG vaccine. The BCG vaccine is developed from attenuated Mycobacterium bovis. Its effectiveness is variable, ranging from only 0 to 80% effective, so we don't routinely give it in the US. All you need to remember, though, is that it can cause a positive tuberculin skin test, even if the patient has never been exposed to TB. Remember I said there were 3 ways TB can progress after a primary infection? And we just learned about one of those paths, the latent infection. I mentioned that most cases of primary infection will heal and become latent. However, there are a few cases that can progress systemically, causing bacteremia. When this occurs, TB can seed almost any organ in the body, commonly affecting the bone, liver, and lymphatics. And this is a very acute, very dangerous process that can quickly progress to death. And this process is called miliary TB. The presentation is variable depending on the organ affected. So if you see a kind of fulminant multi-organ failure in a patient, especially an immigrant from an endemic area, keep miliary TB on your differential. To remember miliary TB, we're going to put millet seeds pouring out of this cart here on the left. Millet's a small grain, and when it's spilled, it can get almost anywhere, which should help clue you into the fact that miliary means it can seed multiple organs. Millet was a grain that was consumed in the days of the Wild West, so it fits well here. We'll also put a sign in the grain that says millet, so you don't forget it. And to associate miliary TB with being a potentially lethal infection, we're going to put a cow skull here on top of the seeds, a grim reminder of this serious infection. So now we've covered 2 of the 3 paths a primary infection can take. Now we'll talk about the last possibility, reactivation of a latent infection. Fortunately, most people with latent TB don't reactivate. Reactivation is only seen in about 5 to 10% of people, and its association is with a state of immunosuppression, such as with HIV, old age, and cancer. The mechanism by which immunosuppression causes reactivation is through the downregulation of TNF-alpha release. Recall that TNF-alpha is a pro-inflammatory cytokine that causes the infection to be contained. If that were then to be neutralized, the infection would spread again. To remember this specific mechanism of host defense downregulation, let's draw a guy here in the middle of the gunfight strapped to barrels that say TNF, as if it were a keg of TNT. This bound, defenseless guy tied up to a TNF keg is to remind you that your immune system is defenseless if its TNF is inhibited. A particularly clever way to test your understanding of this concept may show up on a microtest or a farm test. And this is that if you want to start a patient on a TNF-alpha inhibitor, such as infliximab, you should first screen them with a PPD to make sure that you're not putting them at risk for reactivation of TB. When TB reactivates, it primarily affects the upper lobes, as opposed to the middle and lower lobes during a primary infection. To help you remember this, we're going to have a second cactus on the right side. The cactus will show the anatomical location of reactivation. So just remember, reactivation is on the right side of the drawing. The cactus, of course, also looks like lungs, but this time we'll have the bullet holes in the upper lobes. There are 3 classic symptoms you should be aware of for reactivation of TB. They're cough, night sweats, and hemoptysis. The cough should be easy to remember because we know TB is a pulmonary infection. And to remember hemoptysis, or the bloody cough that may occur, we'll have a character who will be coughing out blood onto his handkerchief. And he'll also be sweating. And we've purposely made the scene take place at nighttime to portray night sweats. And finally, he's inside the macrophage cart just to hammer the point in that reactivation originates from within macrophages. Also, many patients experience cachexia, which is wasting and weight loss, and this is because of the TNF-alpha produced in response to cord factor. TNF-alpha promotes wasting. Aside from these classic symptoms, reactivation TB can affect other places in the body. Let's talk about two common areas, the skeletal system and the CNS. First, let's cover the skeletal system. Pott's disease is when TB has infected the spinal column. Usually, multiple vertebrae are affected, and there is demineralization of the bone with soft tissue swelling, which causes pain. It can progress to abscess formation, spinal deformities, and weakness due to loss of support. We're going to draw a stack of Potts here, and these Potts, for Pott's disease, really resemble vertebral bodies stacked on top of each other, and we've made them cracked and damaged on multiple levels. For some reason, I've been pimped on this point quite a few times. What is the disease called when TB affects the bones? And this drawing's never let me down. It was even a pimping question on the TV show Scrubs. True story. Now, CNS involvement is seen in about 10 to 15% of patients with reactivation, and this can manifest as meningitis or as a tuberculoma, which is a cavitary lesion in the brain. To help you remember this, we're going to draw another character here fighting with our cowboy, just below the reactivation cactus. He'll be hiding behind this cart with his hat getting shot off, and the bullet hole in the hat is to help you remember CNS involvement with possible formation of a cavitary lesion, or tuberculoma. Remember, we also use this hat with a bullet hole going through it in our nocardia video. Alright, we finally move on to the treatment of TB. Hang in there, almost done. TB is often resistant to multiple drugs and has the potential to become even more resistant because the treatment period is very long. So in order to prevent further drug resistance, TB is treated with a combination of drugs. The combination you need to remember for your exam can be remembered with the mnemonic RIPE. R for rifampin, I for isoniazid, P for pyrazinamide, and E for ethambutol. To help you remember the mnemonic, we're going to put a sign here on the cart of taters. The sign will say RIPE taters, and that should be strong enough for you to recall the treatment regimen. Finally, we'll finish up this story with prophylaxis of patients with latent TB. There are two main drugs used for prophylaxis, rifampin and isoniazid. And conveniently, these are the first two drugs in the RIPE mnemonic, so we'll highlight those two letters for you. We'll also give our bad guy on the right, with reactivation TB, our rifampin rifle. If he had used rifampin rifle correctly in the first place, his hat wouldn't have been shot off. And just so you know, prophylaxis with rifampin and isoniazid is for 9 months, a really long time, even longer than this video, which, by the way, is now done. Oof. Go take a break. You've earned it.